States across the U.S. are waiting for CDC recommendations on boosters before releasing their COVID-19 plans for additional shots. A CDC advisory committee is set to meet today to begin discussing the issue of booster shots. The Advisory Committee on Immunization Practices is expected to issue a recommendation after the meetings end tomorrow. Meanwhile, schools in New York City continue in-person learning after a full first week. 87% of all teachers have had at least one dose of a coronavirus vaccine. But with a September 27th vaccination deadline that has been imposed by the Department of Education, roughly 10,000 classroom teachers remain unvaccinated. With me now is Dr. Susannah Hills. She's a pediatric airway surgeon and assistant professor at Columbia University Medical Center. So Dr. Hill, one school has already returned to remote learning because of a COVID outbreak. What are you hearing and seeing from patients and their families as in-person learning continues?
Across the board, Vlad, parents, kids seem to be really relieved and happy to be back in school. My husband's a teacher. He has been so glad to see his students interacting with each other. They're so glad to have that in-person interaction. They're just getting that kind of cooperative learning, collaboration, the things that can only happen in the classroom, that focus together on learning and meeting the milestones they need to meet. And that can't happen anywhere but inside the classroom. So yeah, I think across the board, everybody's relieved and happy and hoping to stay in the classroom this year.
So New York teachers have less than a week to get vaccinated against the coronavirus. Pfizer is, of course, touting the success of its vaccine trials for kids age 5 to 11. And we could potentially see vaccine eligibility for this age group. What would that mean for the rest of the school year?
Well, one would hope that would be one major step toward keeping all of those kids safer and keeping classrooms functional. We'll have to see how many of those younger kids end up being vaccinated when it's available, because, keep in mind, for the kids who are available, those 12 to 15-year-olds, less than 40% of them are fully vaccinated at this point. And I think we're likely to see a similar pattern in the younger kids when vaccines become available. Likely the vaccination rates among kids will follow the vaccination rates of their parents along, partisan and geographic lines. And so, we'll see how many of those kids end up getting vaccinated. I'm really interested to see what happens, for example, in LA schools where vaccines are mandated for kids who are eligible, and see how that compares with other schools across the country and keeping the schools open.
It'll be interesting, too, Dr. Hills, because, what I find sort of interesting about children and vaccinations is that children have a whole host of vaccines that they're required to have before they go to school. And, my guess is that probably in certain states and certain cities, like, for example, here in New York, that you will see a healthy participation rate once those vaccines are available to children. But what's your worry outside of, let's say, the tri-state area, in certain states where vaccine efficacy or vaccine acceptance is low? For example, states in the South and in the Midwest.
Yeah, Vlad, my concern is that these states that are already struggling now to keep schools open, where hospital systems are struggling to deal with their inpatient load because vaccination rates are low, are just going to continue to struggle. Over 99% of the people in the hospital with COVID now are unvaccinated. This is primarily an issue of unvaccinated people now. And if vaccination rates don't change in those areas, the concern is that this is just going to continue to set those areas back. School closures, classroom closures, spread amongst kids will continue, and children will be set back as well. Yeah, it's a huge concern. And, again, the fact that it's, this virus, these vaccines are not designed to be, were never intended to be, or not, there's nothing innate about them that makes them partisan or political, but the process has evolved in a way that's made it political. And unless some of these political leaders take the political oxygen out of these issues, cross lines and join bipartisan efforts to get everybody vaccinated, and now including kids when the younger kids have that option, we're just going to continue to see a divide in this country that doesn't need to be there.
Doctor, one of the things that I was sort of shocked to see was that the United States has now passed the number of deaths recorded for COVID-19, which has surpassed the 1918 influenza epidemic. But back then, we didn't have vaccines, right, to protect people from the influenza virus. We barely understood it. We barely understood simple measures like washing hands and wearing masks, although there was a healthy and robust campaign to ensure people wore masks. Then what I was also remarkable to see that there were anti-maskers back in 1918 as well, using some of the similar arguments that you hear now. But the difference, I guess, for me, and this is what I want your take on, is because we didn't have vaccines in 1918 and because we didn't understand the science, that epidemic was extremely tragic. But here, we do understand the science, we do understand what works, we do have the vaccines, and so it makes it even more heartbreaking to know that there's thousands of our fellow citizens, neighbors, coworkers, loved ones that have perished because of this pandemic when they didn't have to.
Yeah, truly, this is a preventable situation. So it is exactly what you said, heartbreaking to see that this is happening now, that the numbers of not only hospitalizations and illness, but mortalities are so high. And yet we've got a vaccine that can prevent death, that can nearly prevent hospitalization. It's hard to watch, working in a hospital and seeing hospital systems struggle in certain parts of the country, see people get sick, see people die. And looking back at this situation, paralleling what was happening over 100 years ago in this country with similar results, similar deaths, it is heartbreaking to see. And again, it just speaks to, no matter how much time passes and how many advances we make in certain areas, how powerful, politics and other social forces can be.
But, Dr. Hill, one of the other thing, though, is as a doctor, as medical professionals, are you sort of used to this? And I ask that because how many of us, all of us, turn up at the doctor's office and we've got a mole that just popped up on our face, and the doctor says, are you using SPF? Are you using, the protection? And you say, I probably should have, but I haven't. And now you've got to deal with it. Or you turn up at the doctor's office and they say, you've got an intestinal issue. Are you staying away from these types of foods? Or you've got a heart. I mean, this is something that it's sort of, and I guess I'm asking, what do you as a doctor do to counsel patients when before COVID, you were dealing with people who would come in and say, I probably shoulda, coulda, woulda, but I didn't. Now help me. How do you deal with all of that and now this?
Yeah, it is true. People deserve and ask for reasons why medications and health measures are being recommended to them. So giving them, information that includes, numbers, data, evidence, right, that shows why these things are recommended is really important. And then also answering questions that people have is really important. I think everybody seeks information. The challenge is sometimes helping people to get the right information or seek information from the sources that can give them the best information that's available. So, as a physician, I'm just happy to see patients come in and ask these questions. And more often than not, if they're hesitant, for example, about this vaccine or something that, there's a lot of medical evidence about that shows that it's a benefit to someone's health. Usually the reason they're not doing this is because maybe they've gotten information from somewhere else that's telling them that there's a risk or a danger. And often, just by talking it out and giving information to them about the reasons why, and telling them the benefits that we see in our patients. In my personal experience, I see patients benefit from this. That is very helpful. The thing that is hard to watch or that's surprising is that it seems obvious that people are getting sick and ending up in the hospital and dying from this illness. And nearly everybody's been touched by this. Nearly everybody's had friends or family members who died or been in the hospital. So because of the widespread nature of this and how it's affecting everybody, it is really hard to see this and to see that there's still so much hesitation and so much reluctance in certain areas. And if people continue to remain unvaccinated, the concern is, of course, that will just continue.
Yeah, you make a good point, doctor. I mean, it is easy for folks to say, well, I don't want to talk to people if after a year and a half you don't understand the science, then that's your problem. But I agree that, keeping a dialogue with our neighbors, our friends, our family members, and helping them understand and work through this is important. We should all do that. Dr. Susannah Hills, always great to have you. Thank you very much.
Thanks, Vlad.